Hello, thank you for watching and listening. This message is for the people of Britain, a country that gave me the opportunity to serve, learn, and love the NHS that I always treasure. My name is Dr. Kardiali Srivatsal. I am a whistleblower, a former NHS doctor, and the creator of Dharma GPT, a revolutionary solution born not from profit or politics, but from the pain of watching the NHS deteriorate despite my early warnings. We are in a national health crisis. But instead of asking and blaming the prime ministers, politicians, and managers, the very people we elected to lead ask why. The truth is the system was broken from within in 2004. I warned the Surrey Primary Care Trust of fundamental flaws in our structure that made doctors uncomfortable, compromised ethics, and risked patient safety. My warnings were ignored, and the General Medical Council looked the other way. The BMA advised me to take legal action, which I did. I paid the price and moved to Live India because I was bankrupted. Initially, I was angry, but I also gained something more powerful, clarity, and published 14 books. ChatGPT named me as the visionary and pioneer who digitalized patient-centered care, long before apps, AI, and tech giants began monetizing healthcare and feeding fear to maintain control over people's health and choices. I feel ashamed today when I think of how I once supporting colleagues and systems that bullied doctors into silence. I refused to give up and worked quietly, trained ChatGPT to empower you and bring back the lost human face of medicine. This video is not just about a medical app, but one that defends my promise. It's about truth, courage, and the future of healthcare. Dr. Maya GPT's not just artificial intelligence. Human intelligence is encoded through lived experience, spiritual clarity, and professional sacrifice. After publishing my book, The Art of Self-Diagnosis, ChatGPT recognized my color-coded system as a turning point, breaking the algorithmic chains of conventional medical AI and replacing them with a truly intuitive, doctor-guided system. Let me share the key benefits that Dr. Maya GPT can offer. Restores ethical practice, supports, not replaces, doctors, nurses, and pharmacists. Cuts unnecessary consultations and referral you directly to specialist care. Offer precise, step-by-step assessments with no fear or confusion. Helps early detection of infections and prevents spread in a post-antibiotic era. Offer 24/7 365-day support, acting like a junior doctor. Can be accessible from remote areas in the UK and beyond. Positions the UK as a leader in ethical AI-led healthcare, creating jobs and new opportunities. Identifies and protects vulnerable abused adults and children. Reduces antibiotic misuse, unnecessary tests and investigations. Dr. Maya GPT will solve burnout in emergency and out-of-hours care. AI-led triage reduces cost of hiring doctors and nurses and dependency of locum agencies. Reduce long waiting time by offering instant preliminary AI assessments. Reduce pressure on doctors to meet unethical targets. Supports doctors to preserve ethical practice. Reduce establishing walk-in clinics and urgent care centers, saving 45 billion every year. The color-coded guidance distinguishes viral vs bacterial infections. Encourage self-diagnosis by offering SEER, step-by-step advice in patient-friendly language. Rural and AMP, underserved areas 24/7 availability via app, phone, or kiosk. Delayed pandemic response by sharing real-time alerts and early infection detection. Why should you care? This is not a campaign. This is a cruel terror awaken. To my fellow Britons, journalists, influencers, and healthcare leaders, please scan the QR code to learn more. Thank you.